you very much. Let me begin the round of questioning by mentioning that last week the governor of Illinois signed legislation into law to cancel up to $1 billion in medical debt with an investment of just $10 million in state funding. That sounds like a pretty good deal. We're talking about 1 cent on the dollar to cancel debt. Dr. El-Sayed, is that similar to what you're doing in Michigan? Why is that an effective way to go forward to take the burden of medical debt off of the backs of vulnerable people?
Yeah, thank you for the question. So the ratio of 1 cent on the dollar is exactly what we're pursuing in Wayne County. And it demonstrates the fact that though prices have gotten higher, those nominal prices are somewhat arbitrary. And the reality is that after non-payment of a medical debt, the value of that debt falls precipitously. And so we have a situation where I would argue that it's actually exactly the inverse of what my esteemed colleague, Dr. Ippolito, shared, which is that we have a situation right now where hospitals and providers, in effect, will create a certain number and say that's the price of the care. And people can't afford it, but they bank on the fact that a lot of people, because of the kind of beggaring that they get, will try and do so anyway.
How many people do you think you can help by removing their debt for how much money in Wayne County?
We estimate about 300,000.
For how much?
For about $7 million.
That sounds like a pretty good deal.
Yeah.
Dr. Messack, in America, 1 out of every 4 cancer patients either declared bankruptcy or lost their homes to eviction or foreclosure as a result of medical debt. Is there any other country in the world where that takes place?
No, not in the rich world. Countries as rich or close to as rich as the United States do not see this level of catastrophic health expenditure, not even close. We outpace the nearest OECD country by more than 2 times. So you're right that that's not something we see.
All right. And if I am diagnosed with a terrible disease, I worry about that a whole lot. My family worries about that. What impact on my health and my well-being does the worry about financial ruin mean to me?
Thank you, Senator. As Dr. Chino said, and as I mentioned in my testimony, there are so many consequences to worrying about health, and we know that patients who are in financial distress after a diagnosis, who are facing these medical debts, do not adhere to treatment recommendations. They're more likely to die, and this has been proven time and time again from the RAND study in the 70s and to the QJE study just this year. So it's a tremendous health consequence.
Ms. Wood and Dr. Chino, you both have dealt with serious, in one case, fatal illness in the family. What role were bill collectors playing during this process when you were worried about your kids and you were worried about your husband, Dr. Chino? Ms. Wood?
I think it's just the ever constant threat of someone calling to inquire for something that we were not able to pay.
Did that happen often?
I would say multiple times a day, up to
multiple times a day.
Yeah, I would say oftentimes we were in the NICU visiting our children, and we would get calls from debt collectors asking for payment before the boys were ever discharged from the hospital. It caused a tremendous amount of stress on our family, up to the point that we debated not answering our phone many times if we were not with the boys, because we were worried if it was the hospital or a debt collector calling. But we had to answer because, of course, it was the hospital.
So your kid's in the hospital, and you're getting multiple calls a day?
Correct.
From bill collectors?
We had 2 children, so double the calls. Yeah.
Dr. Chino, do you want to elaborate on that, or?
I just want to say how common this is and how heartbreaking it is, that I know from my personal experience, but also that our patients are experiencing on a day-to-day basis, how excruciating these calls are, how harassing and threatening the messages are. I have patients
Elaborate on that a little bit. Threatening, what does that mean? You're dealing with somebody who is very, very ill, right? That's your main concern. What does that mean, threatening?
So, saying this is going to affect your credit, your ability to do anything in the future. We're going to take your home. We're going to take your car. Where your future is over. Basically, I have found that debt collectors will play every dirty trick that they can to try to get you to give them some money. And it's just one extra layer of stress that when you're dealing with, for me, my husband was in the ICU for a month. It's intolerable.
To say the least. I mean, so what we're talking about is a wife worried about a husband in the ICU, or a mother worried about her kids struggling for their lives, having to field off calls from debt collectors. I mean, if that's not obscene, I don't know what is obscene. Senator Kessler.